Anisha Davis, and I'm going to review with you a scholarly essay that I wrote entitled Common Sense Applied, CQI, a Vital Tool in Healthcare Management. What I would like to do before we begin the review is to ask a question. What do you think about when you hear the phrase healthcare crisis? Some of us may think of the Obama healthcare crisis with the insurance that happened a couple years ago. Some of us still may think of third world countries where the children still aren't vaccinated upon birth and they are still susceptible to a lot of the diseases that we don't even really catch in the United States. But what I'd like to discuss with you today is a subject of nursing disparities and nurse disparities in the United States. In 2013, this is according to an article that was on the commonwealthfund.org, is the United States was ranked 11th in 2013 in the efficiency, the access or cost related problems in healthcare, the equity of our healthcare, and the health and the overall health of our lives. So we are ranked 11th. That was 3 years ago. So we were ranked 11th there, and we actually fell behind countries like the Netherlands and Sweden, and the UK was actually the number one in that arena in 2013 as well. So this is an important issue. CQI, I keep saying that's continuous quality improvement. It's a little acronym for that. And what continuous quality improvement is a way for healthcare management and their subordinates and faculty to work together to improve some of these things that we were failing in as far as the healthcare that we are giving in our long term and in our hospital settings. I first started my essay with a little bit of background and some history on public health and what public health was and where it started, which was between the 17th and 18th century. Some of the pioneers of that was John Snow and Edward Jenner. These were two big scientists and physicians in those times, and they actually started a lot of what we call now as epidemiology. But they were the founders of that almost because they found the original origin of a lot of diseases and things that were killing the people off in those days and times. So I started with a little bit of public health information like that, just so we can see how far we've come from the beginnings of healthcare and how important public health is in our century as well. So I moved on to what I felt was one of the bigger parts of CQI, or one of the bigger parts of the disparity, which was patient safety. And patient safety is exactly what it sounds like. It's just the amount of falls and risks that come when you are running a facility and when you're a healthcare administrator. It is important to be informed of these types of instances and issues as they will help you as you prepare for accreditation if you want it, or as you prepare for a annual survey audit from the state government. Patient safety is very important. Like I said, you really have to have a deep understanding of where your patients and risks are being, or your patients are unsafe, or your workers are not being safe with the patients. So that's important to know, so that when you do apply CQI, which was my third topic within my essay, which, like I said, is continuous quality improvement. And really, I kind of gave a lot of personal feedback that I actually saw and experimented with, and trying to get it implemented in a place That ended up being federally investigated and closed down and sold and all that stuff. So it wasn't really that far behind when I suggested that they have a committee dedicated to continuous quality improvement that I was denied shut down, and those were the consequences of not having a CQI committee where there are people who are working within the facility in the hospitals or the organization itself that are dedicated to finding the issues that are brought up during a survey or an audit and applying those corrections annually and monthly, daily, just throughout the year, instead of waiting until the last minute to try and scramble and get things together. And it never works out. It never seems to work out. This particular place that I worked for, I was with that company for 5 years, and 4 years at this particular company, or particular facility rather, they failed 4 years in a row. They failed their annual state audit, and I believe that it was due to the lack of a CQI committee or anybody committed to anything patient safety or improvement as well. So that's really what my topic was and my essay was about. I wanted to show you a couple of the books that I used in my essay. This book here, Implementing Continuous Quality Improvement in Healthcare, it's a global case book. If you are going into the healthcare field or the healthcare administration field, this book here will save your life because it gives you all types of different scenarios and different things that you can keep in mind when you're trying to implement this, if this is what you want to do in your facility or organization. This is a great book as well. I want to move on quickly. This book here is The Principles of Risk Management and Patient Safety. Another great book to have and read, just if you're going into public health or anything like that. This is another great resource to have. These are the risks and factors of patient safety, so it will actually go well along with your CQI book, and it'll help you implement different plans and with different scenarios that you may have in your facility or your organization. 2 more books. I have the Ethics of Healthcare Administration, which I felt was a great book as well. I loved it. I read it twice, so it's just a good book to have as far as when you're in a jam or you're having an issue and you don't know what the ethical way might be. You may be struggling with what you want to do and what might be ethically correct. This is a great book as well. This is something great for those of you that are going to be in healthcare administration. And my last book that I didn't really include in my essay, but I just think it's a great book, is Leadership in Organizations. And this is almost just like a Bible of leadership skills and tools that you can use when you're in a leadership role. And if it's new to you, you might want to read it a couple times because it'll also help you in your continuous quality improvement, your CQI committee. It'll teach you a lot of different ways to delegate. Just a great overall thing. That's it for me. I'm signing off. Thank you. Bye.